I guess about a year ago, our group said, let's just, instead of talking about this, let's try and get it done and try and set up a demonstration project called the Harrisburg Health Information Exchange. And let's listen to what's gone on around the country and watch and try our best effort to get the hospitals here in the Harrisburg area to begin that dialogue on a health information exchange. And this morning, we wanted to give you an update on our effort and give you a chance to maybe ask some questions on where we are with this Greater Harrisburg Health Information Exchange effort. We've got Cam Brown and Jim Krauk from Strategies for Tomorrow, and they're ready to go. Cam and Jim.
Morning. Still morning. In an effort to sort of help get back on time schedule, what we'll do is we'll hold the questions, if you don't mind, till the end of the discussion, and we'll make some time for those then. Okay, we're with Strategies for Tomorrow, and we've been engaged by the TechQuest Advisory Board to conduct a feasibility study for a health information exchange in central Pennsylvania. The organization has asked us to take a look at what's going on and see if there's enough momentum and enough interest to pursue an actual construction of a health exchange in this area. Cam Brown and myself are the folks that are working with Strategies for Tomorrow to support this organization. We're headquartered in Indianapolis, and as you can see, there's extensive experience with health information exchanges around the country. Cam is very much a pioneer in this area, has been working for more or less the last decade with health information exchanges even before they were called health information exchanges. Currently working in Colorado, West Virginia, and recently finished up in the Dallas-Fort Worth area, which is the fourth largest metropolitan area in the country, on a planning effort for that organization. Actually, what was unique about that is it was physician-led, which offered a whole different perspective than some of the others that we've worked on in the past. I'm going to talk a little bit about what we've done in this feasibility study effort so far, and then Cam's going to talk a little bit about next steps, and then we'd be happy to take your questions regarding what's going on. Last fall, we got involved with a survey process. So we went out to the members of this TechQuest Advisory Board, their organizations, to collect data and assess their interest in pursuing a health information exchange for central Pennsylvania. And as you can see, there's some major organizations here that participated. We focused on these 7 initially and went out and talked to those folks. The next stages are, one of the things that's missing as we look at this advisory board is we need to expand it in terms of healthcare in the community. Physicians are absolutely key. That's what we've learned from our experience around the country in this process. So we want to add some good physician leadership, and we're ready to do that as soon as possible. And then there's some other parties to round out that organization. We're putting together a detailed framework for a full-blown HIE planning effort. That should be ready in the next few weeks. And then the process would take place for the advisory board and Kelly to go out into the community to come up with some funding and effort to support the detailed planning process and an implementation for central Pennsylvania. First of all, the survey results, we found a couple of key things. One, it actually surprised me a little bit because typically when you go in other communities, not everybody's interested in participating. But we found here of those organizations that were surveyed that everybody had an interest. Doesn't mean they were all ready to start today. Some of them had other time constraints and other projects that were going on, but everybody was interested in pursuing this effort. We found some organizations were very knowledgeable, wanted to start now and were ready to go. Others were still learning about what is a health information exchange. The other thing is they all require a solid business plan to pursue this effort. As you can imagine, we're talking about some contribution up front of dollars and human resource efforts to make it happen, and a business plan is important to every one of those organizations. And as you might expect, the most desired functionality that came out of this survey were emergency room access to clinical patient data, lab results and reports, medication history, radiology reports, the ability to sign on to the system from one time and access the whole community worth of data, and then the issue with privacy and security is paramount. You probably can't read all these names, but what we followed up after the surveys is we went to each of these organizations and had meetings with their executive staff. And the purpose was everybody sort of had their own view of what a health information exchange was. What we wanted to do was a sort of a level setting process where we talked about what was going on in the rest of the country, how we were handling some of these other statewide efforts, and sort of everybody could react on the same basis of knowledge and information. Some of the key takeaways from these in-person meetings were the community needed to establish a common vision for what they wanted to accomplish in their HIE, in the Central Pennsylvania Health Information Exchange. Again, each organization, depending on where they were coming from, whether they were an insurer or a provider, sort of had a little different view. So we were trying to, the need is to come up with a common view of how we approach this. The other thing is physicians are absolutely essential to achieving critical mass to make this thing productive and viable and to create sustainability. HIE is a platform for data exchange, and it has many functional alternatives. What an insurance company is looking for might be different than what a physician's office is looking for, which could be different again from what a hospital might be looking for. Understanding the proven and common HIE implementation roadmaps, we can offer a lot of help in that area based on the experience we have around the country. The other thing that's interesting is HIEs naturally occur in what we call medical referral regions, and Cam will talk a little bit about the Harrisburg referral region here. It's where communities and doctors and physicians sort of all work together. And benefits accrue to different constituencies at different times. Typically, the insurers get the benefits later on after the healthcare providers help build up and establish the data. And drivers in the community can vary as to why you want to participate in an HIE. Some is the community wants to be in the forefront of the effort. Others are competition between organizations, healthcare organizations, and return on investment is absolutely key. At this point, I'm going to turn it over to Cam Brown.